Good afternoon, ma'am. I am Roxanne Sanonoy from PSN Block 3. For today, I will be going to third demonstration on shoulder dystocia management. First thing is I will gather all the equipments needed for shoulder dystocia management.
So these are the equipments needed in shoulder dystocia management. For internal examination, we have clean gloves and lubricant. For vaginal delivery, we have 2 sterile gloves, 1 straight forceps, 1 Mayo scissors, 1 urinary catheter, 1 placental basin, 1 needle holder, sterile OS, and cotton balls with betadine.
Good afternoon, ma'am. I am Roxanne, your nurse for today. Can you tell me your name? Ma'am, for today, I will be doing your internal examination for progress of your report. I will insert my fingers to assess it. Okay, ma'am? This procedure is to obtain clients' cooperation and actions. Ma'am, you will now be positioned on examination paper. There are 3 kinds of position. We have dorsal recumbent, Smith's position, and knee chest position. But this way, this is the dorsal recumbent. Next thing is draping the patient, exposing only the gynecological area of the patient. Ma'am, I will now drape you and expose only the area I will assess. This is for client's privacy. Now, I already washed my hands and put examination gloves. This way, I will protect the healthcare provider from gynecological diseases. This is now for emergency delivery. I will now call the other healthcare provider to assist me for emergency delivery and neonatal resuscitation. And this is the other healthcare provider. This is Nurse Sophia. Ma'am, I'm Miss Sophia. Next thing is Robert's maneuver. This will straighten the sacrum and decreases the angle of incline symphysis pubis and dislodges impacted shoulder. Ma'am, I will now please hold your thighs and flex them against your abdomen. Next is Mazanti maneuver. It is done by applying suprapubic pressure applied with the heel of clasped hand. Next is Rubens or reverse wood screw maneuver. It is done by inserting my fingers behind the posterior aspect of anterior shoulder and rotate the shoulder toward the fetal chest. Ma'am, I will now insert my fingers. Next is wood screw maneuver. This is done by inserting my 2 fingers on anterior aspect of posterior shoulder and an attempt to make a rotate posterior shoulder to anterior position. This maneuver will attempt to position the shoulder to utilize the smallest possible diameter of fetus to largest diameter of the lumen. Next will be manual removal of posterior arm. The arm is usually flexed at the elbow. The hand is grasped, swept up across the chest, is delivered. Next will be the episiotomy, but it is done by obstetrician or a doctor. Last maneuver is the gaskin maneuver. It is done by assisting the client to roll onto hands and knees and apply downward traction to deliver posterior shoulder. Gaskin maneuver is to moving all force appears to be increased effective on pelvic dimension, allowing the fetal position to shift. Baby girl out, 3:05 p.m. If the baby has a good cry, I will now proceed to the EANC. If not, I will now cut the cord and resuscitate the baby. Now, I will now assess the motor reflex of the baby and assess for any possible injury for the clavicle and humerus. Next thing is I will now assess the postpartum hemorrhage of the mother. After the delivery of the placenta, I will check if it is complete. Next thing is we already removed the gloves and wash our hands. The last thing is documentation. I will document everything that I did and the complications that occurred in the mother. That's for all today. Thank you, ma'am.